name is Daniel Joshua, and I'm a public health specialist. I work with Zanzibar Health Research Institute, which is a semi-autonomous institute under the Ministry of Health, Zanzibar. And my background is in public health, and I've been engaged in project of implementation research regarding AMR, especially in the pediatrics population. In Zanzibar, as Zanzibar Health Research Institute, we're implementing a project which aims to optimize the use of antibiotics in pediatric population in the selected hospitals in Zanzibar, and this is funded by ICARS. So prior to the project, the issue that we have with AMR in Zanzibar, the keynote is the misuse and overuse of antibiotics in pediatrics population. ICARS, under the project, try to solve this by tapping in the system, the healthcare system, trying to help with the National Action Plan, assisting in introducing AMS, antimicrobial stewardship activities, and also improving some diagnostics so that all these could help the doctors make a more rational and evidence-based prescription. And overall, we foresee this to bring the optimal use of antibiotics in the pediatrics population. Working with a multidisciplinary team has been quite enlightening and rewarding. Myself, I come from a public health background, and also working hand to hand with the clinicians and the social scientists and also the microbiologists. So all these guys brings on that part of the view of AMR. So a lab tech might see the AMR with regard to the only microbes and the organisms, and then the clinical part, they do prescription and they don't really think of overuse, and then you have that public health perspective of looking at it collectively, and then so bringing all these great minds together and then telling them that everybody contributes to AMR at some point, and then if we optimize what we do, we can easily optimize the use of antibiotics and then rescue the situation of AMR in our country. That brings in a very good flavor, I can say, of the whole project. We are generating data, and data is something which we really lack, and not only Zanzibar, but in the whole context of Sub-Saharan Africa. Very few research has been directed to AMR. So the project will be an addition because it will generate AMR data, and also with the package of AMS, the antimicrobial stewardship that comes with it, involves trainings and improving some diagnostics. All this is part of the National Antimicrobial Plan, and the project will be adding to it and trying to make sure that we cover as much ground as we can. In the field of AMR, I can say most of the people work in silos, but we need to put our work out there, use social media and conferences and all these reports so that we combine the efforts, we combine the resources. My advice would be to put your work out there, right? So as far as the scientific world is concerned, we usually focus on the end product, the publications, but we need to advertise what we're doing right now, the progress that we're doing, how we're doing it. Even the methodology could be a good addition to other people seeing that we're doing it this way and I've been doing it this way. We could join forces in that. So my advice would be to put our work out there and spread the word that we can fight this when we work together.